Welcome to Unshackled Living.
Good morning and good afternoon, everyone. I'm here with Dr. David Duizer, founder of Noble Naturopathic. David, thanks for being with me here today.
No problem. Great to be here.
So, David, love to hear and speak about this idea of average people taking control of their kind of medical situations or their health. Let's get a little bit of background first before we get into that as to who you are and the kind of work that you do.
Sure. I'm a naturopathic doctor. I've got 3 clinics here in Vancouver, and I have worked with 9,000 Vancouverites on optimizing their wellness and preventing disease. And the core focus of my practice is really programming nutrition and exercise using objective data. So lab work, physical fitness testing, metabolism assessments, and we do primary care in our practice. So, 50 to 60% of people come to see us as their primary care clinician. And so we have prescription rights and lab rights and do all the same things that a medical physician can do. But most of our time is spent going a little deeper than what's traditionally done.
And so do you find that there is an interest in people of trying to kind of take control or maybe move away from their dependence on the traditional medical system?
Well, I wouldn't say moving away from the dependence. Like, we have to really define what is separate from sort of like what we're doing versus what the traditional medical system is doing, because there's it's difficult to interpret for both because there's so much variability within each profession. Like, for example, in my profession, there's a ton of clinicians who don't do any primary care. They have a very specific niche that they work within. Like, for example, they only do HRT, hormone replacement therapy, and that might be the thing that they do all day long.
I see.
Like, I have tons of colleagues who are very, very much niched, like just injection therapy for pain, for example. And then you have a lot of differences actually in the conventional physician world. A lot of people come to me and just absolutely love their family doctor. They get tons of time. They get exactly the sort of preventative medicine that they're looking for. And then tons of people who don't. They get 8 minutes. They get one concern. You've probably heard stories like that before. So because there's such differences, you can go to a chiropractor and not get adjusted. That's quite common. Whereas you can go to another chiropractor and get everything adjusted even though you didn't need it.
Right.
Or maybe their perception was that you did need it, but you get the point. There's differences within the professions. So in Vancouver, where people are trying to be like peak health, kind of as a society, we have that kind of vibe. Obviously, there's a huge demand for what I'm doing, but in other places, that demand might not be there. So to answer your question, are people like moving away from conventional care? People still, I think, here like the conventional care for acute care, obviously for emergency care, and to not have to spend money for advanced care. For example, for imaging, I can requisition imaging, but it costs a lot when I requisition it. Okay. I have no hospital rights, and so there's nothing happening there. You see what I'm saying? So tons of nuance, I guess, to go through.
So how does someone, if they want to audit their reliance on traditional medicine and transition into naturopathic medicine or self-care, how can one go through that type of process?
Well, I think we should probably separate a little bit between like naturopathic medicine and pure self-care, and then look at maybe what might be similar or what we could use to make something that is a program a person could look forward to long-term. Like, for example, naturopaths are really good at creating self-care plans that a person could follow. And the progression towards, I guess we could take an example. A person with low energy who keeps going back to their conventional physician and getting B12 assessments, iron assessments, and thyroid assessments. And for a decade, they've been normal, but they still feel super low energy. They may consider transitioning towards a model that does a little more than those 3 markers. Like, for example, assessing for REM and deep. The watches are not perfect, but they're decent. They give us some information about the quality and quantity of sleep. Someone might transition over to the naturopathic side and say, well, what if there's another nutrient other than just B12 and iron that's important for energy that I could be assessing? They might get that assessment. And so in that specific example, and you could create that example for other sort of health concerns or even conditions, for example, the thing that a person needs is a comprehensive assessment. And that's difficult to do on your own. right? Like there's questionnaires, for example. You know, I've talked offline about certain questionnaires that you could use for tracking. But having objective data, I think, is really helpful. And a lot of that cannot be covered conventionally and needs to be paid for out of pocket in our province. And so that's where this protocol development comes in. So we, like in our practice, we typically have like 4 pillars that are guided by a bunch of different health markers like nutrition and exercise and sleep and stress. But hormones and digestion influence those so significantly. And so we have objective data that will like look for hormones, digestion, nutrient status to inform how we should approach a long-term sort of self-care plan at that point for those 4 pillars. And that generally helps a person manage their disease better and feel better overall. And so we see ourselves as a place where someone can get a really good assessment, but then also develop a plan that maybe they don't need accountability for. On the self-care side, they may be like super motivated and very disciplined and able to follow it. But often we suggest retesting and following up and discussing how things are going. And so we have that kind of accountability piece that we build in.
So if you, if I just go to ChatGPT and say, here's my problems, you know, I want to take maybe a non-traditional approach to fixing these problems. How reliant can I be, and how much consultation should I have maybe with an expert like yourself?
Yeah, well, my experience with the large language models is that they have been very good and very comprehensive and still quite conservative enough to be rather safe from the things that I've seen when people have asked questions like that. So, but still things are missed. Like, so for example, we ask that same exact question to ChatGPT and Claude and to Gemini all the time, just to see what it comes up with. And the plans are usually, and the recommendations are usually really good, but you'll notice if you do it, that the recommendations are usually objective assessment. It's like, go get your vitamin D checked. And that is what, now it could be reflecting that back on me because I am a naturopath and all 3 of those platforms know that I'm a naturopath.
Right, right.
You know, isn't that so cool?
Right.
But patients come to us all the time with these programs, and they haven't prompted these large language models to act like holistic practitioners or naturopaths or even conventional physicians. They've just told them what's going on.
I see.
And the output has been like super naturopathic, thinking holistically, thinking about root cause.
Oh, interesting.
Right? So it's so cool. Like I encourage you to do it, like go in and put like what you're dealing with, and then you may see root cause suggestions for assessment coming up pretty quick.
And is root cause assessment typical of naturopathic work rather than a traditional doctor?
I wouldn't separate the two in that sense because you could get root cause assessment from both worlds.
Okay.
People say that that's very much naturopathic, but I think it's, I know tons of conventional physicians who are like unbelievable expert level at certain things that I am like so far away from, that I'd love to be close like they are. So like, for example, you could say, what could you say? On the cardiovascular world, right? Like we can't do an angiogram. So we can't actually look at plaque buildup in the arteries, whereas a conventional physician can actually go and look at that.
Right.
It's really expensive for us to get scans, like I said earlier. And so they can go and actually look at that. But what we can do is we can look at biomarkers that are not typically covered by the province, like oxidized LDL, like damaged LDL particles. We can actually count particle number. We can do size. So from the cholesterol side of things, can we actually look for root cause? Yes, we can, but so can they. And you'll see that some of them do that too.
So it sounds like, am I understanding this correctly, it's really helpful for you to lean into kind of traditional medical practices for testing and assessments, or maybe assessment's not the right word, and then use the data that's provided from the blood work or whichever to create a plan for an individual who might be struggling with some type of health issue. Yeah,
and often it informs how to expand out the assessment. Like in our world, typically someone would come in with a blood sugar test done,
right,
kidney, liver function done, cholesterol panel done, but them not knowing really if it's that they're like absorbing cholesterol too much or making too much in the liver or not detoxing it on the liver effectively enough. And so then we say, okay, well, why don't we do a visceral fat assessment using a scale that actually measures visceral fat? Or why don't we actually look for the genetic markers for cardiovascular disease risk.
Right.
And then we can go and expand on that.
I see. Okay. How does naturopathic care that you work in help patients exit traditional medicine using tools like metabolic testing and holistic therapies?
Exiting traditional medicine, really, really challenging, say, for example, on the acute care side and the hospital side. Like, there's always going to be risk of emergency.
Yeah.
And on, like I said about the differences in practices, like you could see a naturopath and be getting a really good plan, like that's nutrition and exercise focused, but they might not be someone who has experience prescribing antibiotics.
Right.
Like in my first couple of years, I did it, but it took me forever. Like it took me half an hour to help someone acutely with an infection.
Right.
It would take me like quite a long time to simply refill medications and be confident about the risks and side effects of medications. But after 10 years, I'm insanely confident in all of those things. And
Right.
I consider myself as competent as sort of a general physician that you might find around town on the conventional side for starting a medication, refilling medication, sort of that easier acute care. But you might see a naturopath who has no experience with any of that.
Yeah.
And like, also no interest in doing it.
Right.
And so there's tons to consider there. But how might our program change something? Like say for example, someone wants to be working exclusively with a naturopathic physician. We have tons of things that we can be doing at home to help build out a plan. Like for example, in our office, we do metabolism testing and VO2 max testing for fitness. But there's tons of versions of those that a person can do at home that are pretty darn good. Like you've seen probably on your smartwatch that it will predict your VO2 max.
Right.
They're not perfect, like they're within 10% of the number, but the trend is pretty darn good. If you train better, more efficiently, you'll see it go up. If you
Right.
get fitter, you can tell, okay, my VO2 max looks better. Scales at home that measure body composition, they're decent. On the insulin resistance side, on the heart protection side, and the nerve protection side, you can now buy continuous glucose monitors and track your sugar at home. You can buy finger prick tests and track your sugar before meals, after meals. You can do oral glucose tolerance tests where you challenge how a meal impacts your blood sugar levels. All that stuff can be done at home. And we like to facilitate that with someone. Like say, for example, someone does a VO2 max test and we set up this exercise plan. Well, we can say, okay, here's the limitations. Here's how we should train. And if you follow this, your VO2 max should go up. And here's how you can assess it. In 12 weeks, you can do either a Cooper test at home, which is a 12-minute run, and there's a calculation to figure out your VO2 max. Now, alternatively, you can do a beep test. Like a beep test has a calculator that can help you determine like approximate VO2 max.
Yeah.
And then you can track that and track your fitness from there. With continuous blood sugar monitors or at-home finger prick monitors, you can change your diet. And then you can wait 12 weeks and see if your responses to food are better. I love that, like, because it's empowering, right? Like now you've got something you're watching at home. You don't need a physician's support. It's really cool.
And how much are you recommending that people lean into like supplements and vitamins versus maybe just like changing their diet or exercising more?
There's a lot that goes into nutrient levels. Like absorption is a key piece, right? The nutrient deficiencies within the foods, expecting to get a certain amount of nutrient, but it not being there. It's really challenging to figure out. So we do diet recalls, we plug it into systems, we ask it what we think the nutrient levels actually are, and then we still can't be sure. So we run tests. There's also genetic differences. This is one thing that it's kind of interesting about both worlds, traditional and conventional worlds. There's so much difference in our genetics for absorption of nutrients and the utilization of nutrients and the actual demand for nutrients. It's kind of wild, right? Like some people just need more vitamin D because their receptors are less receptive, or the conversion of D2 to D3 is less efficient. With omega-3s, it's the same thing. And so you can't really account for that except by using labs and seeing if the number's going up.
Right.
And we have some people who are on programs where they're like being very conservative and just inching up doses, say, of omega-3s and not seeing the omega quant change too much because their genetics confer a need of omega-3 that's like way higher than maybe you or I.
I see.
So super interesting.
Wow.
Yeah.
Is it a waste of time or money to go to the drugstore and buy vitamins and start taking those types of things?
Without guidance.
Yeah.
Like it totally can be, except for vitamin D and D3. And I would say that probably magnesium is probably going to be the next recommendation if I were in charge.
Yeah.
Yeah. Cause it's like super difficult to get adequate amounts of magnesium in the diet. And so people take that and feel so much better. And it's
So kind of like most people should just take vitamin B, B3, and magnesium.
I don't know about the B vitamins.
Oh, didn't you say B?
D.
D, sorry.
D3.
D.
D3. Yeah, sorry. D3 and magnesium for sure. Like, do I want to make a blanket statement on here about everyone taking that? No, because we do see high levels, people
Sure.
taking too much.
Yeah.
And now I'm in Vancouver, man. Everyone takes vitamin D and magnesium. And we have seen high levels of vitamin D for people taking more than sort of like 2,500 IUs per day. But it's super rare.
Okay.
Like still very rare. So do I think people should just go out and take supplements on their own without guidance? I absolutely do not. I think they should do that with the exception of those two being very, very safe at low doses, and low doses should be determined by your healthcare team,
Right.
but you know what I mean? So are people able to completely move away from a medical setting? Come on. People have been not working with physicians for millennia. We're new,
Right.
pretty much, right? Like it's kind of crazy, but we think we're pretty good.
Right.
So do I think people could benefit from getting advice? Yeah, totally.
Can you give us some examples of when, maybe some stories or a story of a patient who used some holistic tools, or maybe they were involved in fasting that really had, I don't know, some kind of change in their life?
Yeah. I mean, fasting is interesting and very complex. Like,
I say that because I fast.
yeah, you fast.
8 p.m. to noon.
Okay, nice.
It's hard.
It's very hard. And some people completely ruin their metabolism with it.
Really?
Oh yeah, totally.
Oh,
Like,
great.
intermittent fasting, it's like anything, right? Like vitamin D is great until it's too much. I mean,
Right.
water is great until it's too much. But like since like, 2020 or maybe a few years before, people have been all in on intermittent fasting, and I was and still am to a certain degree. But people get carried away, and like I said, it's very difficult to know about your nutrient levels.
Yeah.
So people get deficient in nutrients. Say, for example, you skip breakfast, but that was the only time you ever consumed calcium. Now, all of a sudden, I've been doing intermittent fasting for years, and it's like, seems like the right thing for my body, but all of a sudden I have this ache and pain going on, or twitching in my muscles or something like that. And you just didn't know that you were way under in calcium for years because it was you only got it from breakfast.
Yeah.
So very difficult to make blanket statements
Yeah.
about it. But some examples, like where someone has integrated a holistic therapy and saw a major change. I mean, we do nutrient tests all the time for things that are not conventionally assessed. Like I give this example of low energy, for example. Sometimes we find like low boron, right? Or we find,
Never heard of boron.
yeah, it's a mineral. It's a very important mineral. Sometimes we see examples of like low B5, and low carnitine, and then people replenish and feel amazing, energy 10 out of 10. And so very, very, very obviously there can be nutrient deficiencies that are super sneaky. We see examples, my example of REM and deep being insufficient earlier. People think they sleep really well
Uh-huh.
and don't realize that they have wakenings or that it's very light for very much too long. They think that caffeine doesn't bother them because they can fall asleep very quickly. But then all of a sudden do some sleep assessment and notice that their quality of sleep is very poor, and start something like magnesium threonate or magnesium bisglycinate and cut the caffeine before bed, and all of a sudden have improved quality of sleep, and all of a sudden their life is completely transformed. And we see it in environmental burdens as well. Like there's a lot of mold toxicity, of course, in Vancouver. It's a very moldy place. There's also a lot of heavy metal toxicity in our province for some reason. People clear out environmental pollutants and all of a sudden feel very, very, very much improved. Something that's not typically done in the conventional physician that we do.
Yeah.
Yeah.
I heard, Dr. Huberman, maybe he's a controversial figure, but him talking about sleep, and I started taking threonate and theanine, and man, it's like really has helped. Really has helped, because I just wake up in the middle of the night all the time at 3 o'clock for 2 hours, and then I fall back asleep, and then I feel terrible, like I had a long nap or something.
Right.
And that's helped me, kind of stay asleep longer, which has been really helpful.
Love it. It's amazing. Yeah, this is super cool about magnesium threonate. It was promoted for focus last year when it first kind of like hit the market full speed. So I took it in the morning. But I was like falling asleep at work. Like it's insane. It was insane. I was focused for the first little bit, like I thought maybe placebo, but then I was falling asleep. And then in August, when everyone on podcast started talking about these new trials about it being for deep sleep, I switched it to nighttime, just like you, and it's like amazing.
Oh, I didn't realize this was like a new thing, because maybe I heard him talk about this like 3 years ago.
Wow.
And I didn't realize I was on the leading edge of natural health.
You're on the leading edge. Magnesium 3 and 8. Yeah, man, I'm podcast out. I'm here to hang out with you.
So let me teach you a thing or two here.
Please do, yeah.
So that's interesting. Yeah, and at nighttime it helped. We started giving my daughter magnesium at night to fall asleep. She was having problems, and that's helped her as well, which has been great.
Amazing. Yeah, Life Labs just started offering the red blood cell magnesium assessment. They send samples down to the States and assess the amount of magnesium in a red cell. And it's much different than electrolyte levels. We run that all the time now and find levels that are very low.
What's one protocol that you often are recommending to build resilience against cardiovascular hormonal imbalances?
Cardiovascular and hormonal imbalances?
Yeah, sure. Go through both. So
cardiovascular wellness is the most important thing in all of wellness. Cardiovascular disease prevention is the number one killer of Canadians. And so, but it turns out that having the highest VO2 max, being the fittest you can possibly be and the leanest for that level of fitness, confers the best risk against cardiovascular disease and cancer, by the way, of all the things that we know. It's like, don't smoke and don't be obese and be as fit as possible.
What about alcohol?
Alcohol's on the list too. You know, the level that is recommended is 0. And of course, that's because any amount is bad. But I see value in social consumption of things that are not high alcohol. But the value is 0 for optimal wellness. But, cardiovascular disease, it's a VO2 max. So it's oxygen consumed per minute divided by body weight. It's a big equation that is done on an exercise assessment. But the point of it is like you want to be as fit as possible. And the Health Canada recommendations of 2.5 hours a week is pretty good. And 5 hours a week is way better.
Of fitness?
Training, moderate intensity training.
Okay.
So what goes into this? So we have this score, oxygen consumption in the cells. We have these mitochondria that consume and produce energy. They're more dense in the muscles. So you want to have a good amount of muscle mass that confers a high level of strength. And because of that, you can consume a lot of oxygen. And you can consume it fast if your nervous system is trained. So you train pretty hard to improve the ability to consume oxygen fast, and you train pretty easy to improve the efficiency of oxygen consumption and the fuel utilization, fat burning and carb burning. And so we have that. It's like volume of muscle and then maximizing for inefficiencies divided by weight. So being as lean as possible and have a low body fat percentage with no fat around the organs. So how do we do this for cardiovascular risk reduction? And by the way, this is way better than cholesterol and blood sugar and blood pressure scoring for longevity when it comes to cardiovascular risk. All 3 of those are important. So is inflammation scores. But fitness is more important. So if we have all 4 or 5, if we include fitness, inflammation, blood pressure, glucose, and sugar and cholesterol, we've got something really good. And so 2.5 to 5 hours a week, divided in a way that incorporates strength, low intensity cardio, and high intensity cardio. And now you've got the volume of muscle and the ability to express it. You've got inefficiency for fat burning at low intensities, and you've got the ability to ramp up the nervous system using high intensity work. And so that's the best way to prevent cardiovascular disease. Combine that with a Mediterranean diet, forget all this other stuff, and it's golden. On the cancer side of things, it's like there's 1 in 10,000 different types of DNA breaks that can occur. It can be random, but it's also can be because of the environment that a person lives in. And there's certain things we can't change, socioeconomic status, right? Like exposures that are unpredictable, like radon exposure and secondhand cigarette smoke and all this stuff that can cause DNA damage. But we can control VO2 max, fitness level, and we can control to a certain extent our body composition. And we know that both those things are very important. And I've got, like I said, 9,000 patients. I've got 3 people who are super fit and healthy overall and have gotten cancer, but that's a very small minority of people that we work with. Yeah.
So 3 really fit people have got cancer, but
in my practice, yeah.
But generally speaking, it makes a big difference.
Huge. And so on that side of things, it's like, we want to go all in on the lifestyle stuff, right? We have this fitness side, which is nutrition and exercise. But there's also the component for both cardiovascular disease and for cancer risk reduction, like sleep and stress. And hormones and digestion definitely impact both of those. So people who have really high stress, that might be the wild card for both of those conditions. That's hard to determine and very important. And it's obviously worse with lack of sleep. and lack of sleep prevents a person from reaching their peak fitness because they're just not recovered and can't train as hard. So there's considerations on that holistic side of as well. Now we can kind of transition to hormonal imbalance, and holistic approaches for hormonal imbalance are a little more tricky because of this complexity within the genetics. For example, some people just have like a ridiculously high level of hormone receptors. It runs in families. Like you measure their hormones, are totally normal, but they've got hormone dominant symptoms, for example, like estrogen dominance, or they've got some high testosterone type symptoms, for example, in polycystic ovarian syndrome, PCOS. It can be because of high receptors genetically determined. There's also liver detox of hormones. We make these hormones, we clear them, they go into the urine and the bowels and they get cleared. Everyone's liver is a little different. There's tons of pathways involved, and sometimes the pathways are like really active and sometimes they're less active. And so we assess all of those things in our practice, not receptor density, but the effectiveness of the liver through some comprehensive assessments. But at home, how can we maximize the effectiveness of our hormone production and of our hormone detoxification? It's like sleeping through the night and keeping stress low seem to be really important for both of those things, and not having a high level of adiposity. So that's the fat on the body. The fat stores hormones, and sometimes it just gets to be too much. And so lean but strong, really, really important. They can go too far too. Being too lean means you might not have enough hormones stored for backup reserves. So we like to track all of those things and make sure they're optimized.
It seems to me that growing up, there was always like this emphasis on like cardio, like go for runs, like do a lot of cardio. That's how you stay fit. That's how you burn fat. And now I seem to hear more people talking about, well, actually you should be like lifting. You need to build muscle. That's maybe as important or more important. I don't know. But there seems like there's been maybe a shift in the emphasis in that area. Do you see that as well?
Oh yeah. Because of people online. It's like, well, cardio is worth it or worthless.
Right.
It's craziness.
Okay.
It's craziness. Can you run away from or run off a bad diet? Not really.
Okay.
I mean, you see, we have to qualify a bad diet. Like, look at marathoners, right? 500-600 grams of carbohydrates per day, but they're training 100 miles a week.
Right.
And so they're burning it. Like, they can do it. And we wouldn't call their diet bad. They're fueling up for their training. But for us who don't have the time to run 2 hours a day, I mean, you really can't outrun processed foods, high calorie dense foods. It just can't be done. You can improve your metabolism by having an adequate amount of muscle mass. Muscle is the main part of our physiology that drives metabolism, because that's where most of the mitochondrial density is. There's organelles that produce the energy and actually cause what we call calorie burn, but it's really energy production. They're in the mitochondria. So people who are under-muscled have lower metabolisms.
I see.
And it can be like 500 calories lower than predicted. So people can be like thinking they're eating in a deficit, but not be, because their metabolism's so low because they're under-muscled.
I see.
So people online go on and say, lift weights every day and eat as much protein as possible and you will lose weight. And it's not true. It helps people who have really low amount of muscle to get their metabolism back. Having a high protein diet generally causes them to eat less of the other two macronutrients, carbs and fat. But it's definitely not perfect for everyone. And we see people's cardio diminish because they can't get to the amount of intensity at each zone that we want to prioritize just by doing weights alone. It's not possible. And so are they maximizing their VO2 max by doing this? No, they're looking at one piece of the equation, and that is having the appropriate amount of muscle mass to actually consume the oxygen. But we need to train the heart and we need to train the nervous system in order to consume that oxygen at both low and high intensity, low intensity using fat and high intensity using carbohydrate.
Yeah.
So we have to train those things. So a balanced approach is so much better, but it's not sexy.
Right.
I mean to say, run super slow for a long period of time, and then once or twice a week, do high intensity intervals for like 10 minutes, but then also strength train 3 times a week.
Yeah.
That's not exciting, right? It's insanely complex. And
Yeah.
that's why I think that our roles are valued, right? As naturopathic doctors, there's value there.
Right.
So, okay, for your position currently, we can tweak the ratio a little bit. Do you need to be doing high intensity 4 days a week for 45 minutes? No, it's not helpful. Do I think that I agree with a lot of the physicians online saying transition all of that high intensity over to strength training? No, that's insane. That's ridiculous. So personalized programming, and to your point about AI, a lot of that can be done if you plug in what you're doing. If you feel comfortable sharing your personal information, you plug in what you're doing and maybe some metrics about how fit you are, like how fast can you do the Cooper test, or how far can you go in the 12 minutes? What is your muscle mass on a body composition scale relative to the predicted for your age, height, and gender? Then it might say a little more strength, or it might say a little more cardio. That's what naturopathic doctors do.
How important is the type of food I eat versus the number of calories I consume? Like, can I eat Triscuits and cheese all day long and be okay if it's at a calorie deficit versus eating, like, I don't know, healthy, nutrient dense fruits and vegetables?
What's the goal? What's
Okay.
the goal?
I guess fat loss, let's say.
Fat loss, yeah, but you're going to get nutrient deficient.
Okay.
Yeah, so here's what happens. People just completely ignore this, and this is like just insanely important. I've done 1,000 metabolism tests. I measure metabolism all day long, and by metabolism, I mean calorie burn at rest and during exercise. And we see people who are in some type of macronutrient or total calorie restriction with diminished calorie burn. Their metabolism is lower. So I created this framework around to optimize metabolism. It's called Fire Up, and it's a mnemonic for a bunch of different things. But the first thing is F, and it's fuel. Not being deficient in any macronutrient, carbs, fat, or protein, and not being deficient in any micronutrient, while still, if you're looking for fat loss, being in a subtle deficit. So you can have the best of both worlds, where you're getting all the nutrients you need, the right split of macros for the goal that you have, but also be in a calorie deficit. And that is the fuel piece. If we meet that, we can keep metabolism appropriate for age, height, and gender, or I should say at least predicted, at the predicted level, the calculated level, and still be in a deficit and lose fat.
Okay. What do you think of, this is a bit of a question that I've had in my head, and I've always wanted to ask you, is cold plunging worth it?
Is cold plunging worth it?
Because I go cold plunging all the time,
Yeah.
and I don't like it,
Yeah.
but I think it's good for me, but I don't actually know.
Sure.
Is it?
Well, it's definitely ramping up your nervous system, getting you fired up for the day.
Yeah.
I love that.
Yeah.
Yeah, so like having, exercise is meant to be inflammation inducing.
Right.
Like when you train, you're sore, there's an inflammatory process that's putting you back together. Your body's releasing a bunch of factors that are reparative. They're literally repairing the tissue. And we call it inflammation. And cold plunging suppresses that. Like if you ice it,
Yeah.
you're not going to get it.
So is that good or
That's
bad?
bad.
That's bad.
Yeah, so if you have a cold plunge, I think it's well known now. I might be speaking out of turn, but I think it's well known now that if you cold plunge after a hard workout, you're not going to get the benefit of the workout.
Oh, interesting.
Yeah.
What about the next day?
It might be okay.
Okay.
Yeah, I think there's a delay. It depends on a person. So,
Right.
newbie gains, right? Like you may be sore for like 3 or 4 days. That's inflammation that needs to put those tissues back together.
Okay.
But if you're a well-trained athlete, you're recovering in 12 hours, you could probably cold plunge in 12 hours. It might be fine
I see.
because you just don't have that inflammation that's occurring.
Yeah. What it's interesting how you answer my questions, because almost every time I ask you a question, you kind of are saying it depends, right? It depends on who you are and all these many factors. And like, what is the goal?
Yeah.
Right. You seem to kind of go back to that continually after every question, which is it kind of speaks to the fact like there is no silver bullet. There's no panacea. Like it really depends on so many different factors, which I guess puts a lot of value on you and other naturopathic doctors to work with individuals to get customization.
With trying to not say it depends, because like out loud.
Right.
Because so many people just say that, like I'm coming from an academic world now, and where the professors just say, well, it depends.
Right.
And then, people have to ask follow-up questions and then
Yeah.
kind of go down the path, and it's so annoying.
Yeah.
Like it's terribly annoying.
It's like when you ask for legal advice, they're like, well,
Well, it
I mean,
depends.
no, it depends.
Yeah, no, it depends. In health, there's like an insane amount of nuance and tons of genetic difference.
Sure.
Right? But also lifestyle difference and environmental exposure difference and all these other differences that are difficult to manage. There are a few things that are like set in stone. Fitness, body composition, like high level of muscle, low level of fat.
Yeah.
No fat around the organs. And then there's a lot of nuance with respect to everything else. Like people in my world are obsessed with sort of like LDL cholesterol not being bad. Even though we know that it's an independent risk factor for cardiovascular disease, like having high LDL increases the risk. I had someone yesterday who had a very high level of LDL cholesterol. We ran a calculator. That's a really good evidence-based calculator called ASCVD. And with their blood pressure, their body composition, their diabetes status, their smoking status, their age, their high level of cholesterol did not confer an increased risk among the average person.
Mm.
Take that same person with any of these other metrics, slightly different, the risk is going to be higher for them. See what I'm saying?
Yeah.
Like, evidence-based calculators are super helpful for that. They'll say, well, is LDL is not important? That's insane. For some people, it's really important. And for other people, it doesn't make any difference. So then we run it for a decade later when it actually does make a difference for that one person.
Right. Yeah. Over the last few years, I've trained for 10-kilometer open water swims. So I'm swimming for, 2 or 3 hours in the ocean, 6 or 8 kilometers or whatever. And it just absolutely destroys me for the rest of the day or the week, and I find it so difficult. And so I don't know if I'm going to do it anymore because I'm like, this is just too hard on me to do that. And then I'm cold because I'm in the ocean after that. And so it can be quite hard to recover. So when you're looking at like that kind of level of athletics or fitness, how does one quickly recover or more quickly recover from these types of situations?
Right. Well, in that case, there's a lot of nervous system fatigue because you're dealing with the extra element of the temperature.
Mm.
But for most people, it's about having enough nutrients for the repair systems to be effective.
Okay.
Like when someone's low in vitamin D, the repair can be worse. If they're low in branched chain amino acids, like they have a leucine deficiency or something like that,
Yeah.
the repair can be worse. If their total amount of protein is too low, that's a challenge. If they don't get a deep enough sleep, it's a challenge. If there's something disrupting the capacity to absorb nutrients, like a high stress level or eating too fast and not breaking down the food, like all these things are going to impact recovery.
Yeah.
And so our goal with athletes is to have them recovered like in 12 hours. Like you should be able to do 2-a-days after a few months of doing something.
What's a 2-a-day?
Train in the morning and train at night.
Okay.
If a person can't, they're either doing way too much or something's impacting their ability to recover.
Mm.
Yeah. So we try to look at all those potentials.
Yeah.
In your case, I would add this like super variable thing, which is like ability to tolerate temperature change. And that's a big challenge.
Mm.
I would train, if I were in your shoes, I would not train with the temperature.
Oh, interesting.
Yeah. I would train like in a pool.
Train in a pool, yeah.
Train in a pool. And then every 2 to 4 weeks, assess your capacity to compete with all the elements.
Okay, that's good. How does diet how does diet and movement impact sovereignty, prevent diseases like diabetes or cancer or anything like that? How important or what can we like really do to deal with this?
Yeah. So when you say sovereignty, I think of health agency, right? Like what is on top of mind for me that I can do for me?
Yeah.
Nutrition and exercise are the top 2 things. Prioritizing healthy lifestyle change and I would say capacity to knock these 4 pillars out, sleep and stress management. So from an agency standpoint, we can think of the things we know for sure. Like we know the Mediterranean diet.
Yeah.
We know that for most people who don't have some condition or who haven't been restricted in their calorie for a long time, that calculators for metabolism and total need for nutrient are decent, right? So you can know in 2 seconds how much food you should probably be eating and what types of food you should be eating because it's like no-brainers for these 2.
I see.
Now, take some genetic differences like within populations. Like for example, maybe there is a population within the world, and I think there probably is, where the calculators are less accurate, but still decent. So from an agency standpoint, you have to manage what you can control from the nutrition. From a nutritional place, there's costs involved, your capacity to spend money on food.
Mm-hmm.
If you're growing, the capacity to grow your own food and seasonal change. And you just try to control as much around food as you can and try to do it like 80% of the time or more.
Mm.
So I really like that. Then on the exercise side of things, it's like knowing that just if you do one thing a lot, you're going to start to suck at other things, right? Like we're not seeing marathoners squatting heavy.
Right.
And being able to squat heavy might be actually really good for longevity, or having like really ridiculously good grip strength. We're just not going to see that. And so you have to think about variable kind of exercise and checking some boxes as you go.
Right.
Grip strength, leg strength, total muscle volume, low fat level, but also having that cardio piece. So it's like hybrid training, I guess is the kind of the thing I'm trying to get across.
I've heard things like you should be able to, carry your own weight for a certain number of meters or minutes, and that's an indicator of, longevity and future strength when you're elderly. Or racket sports, for example, being really good to help you live a long life.
Definitely.
Are these things that are true?
Are they true? Oh yeah, I love these. I love the physical fitness contests. Like I've heard people even talk about some standards to try to shoot for. I've got 5 of them on my wall at home in my gym.
Okay, what are they?
It's like, I don't remember them.
Come on, give me a couple.
I just put them up. It's like ability to do a 2-foot bound.
A 2-foot bound.
Yeah, 2 foot, like a bound standing.
Yeah.
Broad jump.
Okay.
How far can you broad jump?
Yeah.
It's like your height or something like that. You have to look it up.
Okay.
And then how fast can you run a kilometer or a mile? Like picking a level and how fast can you run that? There's a standard there. Your grip strength, to your point about grip strength and being able to carry for a certain number. I love those. Like set a standard for yourself. Find some standards. Try to meet them. It's really, really helpful. Like I talk about the VO2 max test, like the Cooper test.
Yeah.
And the beep test was my whole thing growing up, right? Because I was in the Navy and the military in general, and we love the beep test in the military. And so we had standards. Like I was part of this kind of everyone at the military school that I went to had standards to hit in a ton of different things. Push-ups, sit-ups, standing broad jump, beep test. And I would try and crush those standards. And now as an adult, I'm starting to think more on this agency side, but how important that is to set standards for yourself and make sure they're evidence-based and go for them.
Oh, interesting. So you run a bunch of clinics, you got a lot going on, family and young kids and all this kind of stuff. Like how happy are you with your own health? Like, are you able to apply a lot of these principles, or is it still a realistic struggle for you as well?
It's a realistic struggle, I think, for all dads. I got 3 kids and 3 clinics.
Yeah.
And tons of employees and lots of things going on. So am I happy with exactly where I am? No, definitely not. There's always trying to improve on certain things. I was much fitter when I was younger, and I'd love to get back to that.
Yeah.
But there's seasons to life.
Right.
And this is the thing that I try to reflect on and help people reflect on. Like, are you going to be in peak physical fitness when you have young kids and high demands? No, you're not going to. It's just not. It's actually can be considered pretty selfish in certain circles.
Sure.
Right. To be spending hours a day doing that. and to each their own. Right. Like I work with a lot of endurance athletes who do have kids, and it works for their family.
Right.
It doesn't work for my family. I can't go and run for 2 hours. It's not going to happen.
Yeah.
And so the personal question about where I am, I maximize my time. Absolutely try to. I have everything I need at home. There's no piece of equipment I'm missing. I teach speed training to kids. I'm in the fitness world. I have 30% of my day is spent with athletes, and I try to be in their headspace and apply that to myself. Right. So if I get 10 minutes, it's like dips. Yeah. Right? It's push-ups. It's trying to do the thing that I can with my time. When my kid is driving his four-wheeler around, I'm running beside him.
Right.
This is the thing we try to do.
Yeah.
So I would say that coming from an athlete world, like I played basketball in college and I was a multi-sport athlete in high school, like I'm never satisfied.
Right.
But I think that in the next season of life, there will be more time for that. And that will be when I hit those markers.
Yeah. So when you talk about like, okay, you're running alongside your kid or you're doing dips when you have 10 minutes, how much value is there having a workout for 45 minutes versus like just doing those types of things?
Oh my God. Again, not to say it depends, but you have to check on your goals. What are you trying to do? If you're trying to maximize your time, then it's the all-day workout, right? Whenever you get a chance.
Is that a thing people say, the all-day workout?
Yeah, definitely. Like 20 squats when you go to use the washroom, right? 3 or 4 times a day
Really?
like during your workday. Oh yeah, totally.
I've never come across
the
this.
all-day workout is super important. Yeah, man, for like me and you.
Yeah,
definitely. Okay. We should get down to push-ups right now. The all-day workout is like ridiculously important. So, but if I were training for the BMO, then I would have to have a mileage that I did every week.
For context, that's a marathon.
I would be crashing midway through, like literally failed body taken to the hospital without hitting a certain amount of mileage per week. And so if your goal is that, it needs to be a structured program. If your goal is to not lose muscle mass and get through and be present within this season of your life, you can do that with not much structure.
Right.
Like show up for hockey on Thursday nights at 10. You know what I mean?
Yeah.
And you're going to be probably okay.
Yeah.
Train once a week, and you probably won't lose much muscle.
Yeah.
Eat enough protein, do that, you'll be fine. Cardio obviously is going to dip unless you have something structured. But if you do a little bit, the basics will be there, the baseline, and you can then come back to it later.
Okay. What about working through injury? For example, I think I've torn my meniscus. I'm waiting for an MRI.
Shoot.
It's been like 6 months. It's annoying. It's not super bad. So I've really kind of stopped doing cardio.
Yeah.
So when you're working through an injury like that, and I focus more on lifting, especially upper body, as I work through figuring this out, as someone's working through injury, are there things that practical steps or standards in which can help us recover from those types of situations? Or is it really, it has to be very customized in that scenario?
When there's a lower body injury, I think that people can generally take their legs out of the equation and do rowing. I think that it can be done.
For cardio?
Yeah.
Oh,
I
interesting.
think it can be done. So for example, you just don't press on the legs, you just do most arms, right? Like, so you can get your heart rate up without having to activate your legs significantly. And it's the same thing with endurance training. So for example, you can do weight training in endurance style, 2 sets of 30. It's just that you don't want to do more than 2 sets because overuse injuries are common if you're doing 10 sets of 30.
I see.
But you can do 2 sets of 30 of, say, for example, seated row and lat pull down on lighter weights and tons of different pushes and pulls and things like that, and get your heart rate up to a zone 2 level.
Yeah.
220 minus your age times decimal 7, and you can probably get there and stay there if you're supersetting 2 sets of 30 in a bunch of different exercises.
I see.
So there is a potential to keep some capacity of your cardio if you get a lower body injury.
Yeah.
Now, I think that physical therapy should be customized, of course, and personalized. And physios is like one of the most common professions in our province, and for a good reason, because they do such great work. There's tons of nuance with rehab, of course, and lots of physios do things differently. So finding the person that resonates with you and helps you get back quicker and has some a great reputation, has gotten people back quicker, I think it's important.
What type of practitioners do you often recommend people go see? Like when you see, are you sending people to physiotherapists, chiropractors, nutritionists? Like who are you often seemingly sending people to go to?
I'm not typically sending people other places. Okay. We don't have referral rights.
Okay.
So the main limiter, if we talk about sovereignty, for example, the main limiter in the private medical space in British Columbia is that naturopathic doctors cannot refer.
Oh, interesting.
And everything we do costs money. So labs and images, we cannot refer, and that is a challenge. So if
you mean you're not allowed to refer? Like you can't say, Jarrett, that physio is great?
We can refer, we can send people. Yes, we can do that. Absolutely. Okay. So I guess I should qualify. Refer means sending someone to a specialist.
Right.
Yeah. So we can send people to physio, of course. It's not like an official referral.
Gotcha.
But we're sending it to our person that we trust.
Yes.
Yeah, totally. So the most common would be physio and massage, my practice. People don't typically come to me for pain.
Okay.
And so even though I respect chiropractors, it's just not something we typically refer to because we don't do a lot of pain. I don't do a lot of pain management. Yeah. And so physio and massage therapists are the number 1 and number 2. And I say number 3 is counseling. Those are the 3. And then on this conventional approach, we're just missing out on that referral and the hospital rights. So we just can't do those 2 things, and that limits us a little bit.
And does that vary between provinces and states?
Every province and every state.
They're all different?
Absolutely.
Okay. It's very, inconsistent.
Completely.
So what are you hoping to see in the future for yourself when you talk about naturopathic sovereignty in educating communities? What's your vision for the future as a clinic owner and a doctor?
My vision is that we're accountability partners, accountability coaches, that we're taking people through healthcare programs that optimize their wellness. So we have 3 streams currently. We have the chronic disease management stream. We've got chronic disease management and chronic disease prevention. We've got people looking to alter their body composition and become fitter. And we've got athletes. And I see each of those streams absolutely thriving, and us creating health plans for as many possible British Columbians that we can within all 3 of these streams, and having evidence-based and objective measurement, treatment and measurement, so that we can show them how much healthier they're getting. And so from an agency standpoint and a sort of a sovereignty standpoint, people, we're private pay, right? People come to see us for our expertise and for our advice, and we give them plans and we help them run their labs, and we help them with their tracking. And so there is a significant opportunity to work with people all over the province, and we do, from the island, up north, everything. and they very rarely have to come here to work with us.
Oh, interesting.
So much of this can be done from a distance.
Oh.
For example, we have lab rights all over the province through simple requisitions.
Mm-hmm.
Through more advanced labs, they're done through the mail. They're sent to a person's house. They do them. Every 6 months, they do them. And they see how things improve with the protocol that we have worked on together.
Yeah.
And so I see us as being those guides, right? And how does that differ from the conventional world? Conventional world is condition, some general advice, usually pretty good if there's time. If it fits within the visit,
Mm-hmm.
it's easy to say, eat a Mediterranean diet.
Yeah.
And then take this medication and follow these labs. Pretty simple. But in an hour, we, naturopathic doctors, can make the meal plan.
Mm.
We can ask you your favorite foods and put them in.
Yeah.
We can ask you about what equipment you have for your training. And we can fine tune the program, sets and reps and duration. And we can have some touch points midway. So we have WhatsApp groups for our athletes. We have email correspondence with people doing check-ins.
Mm.
We have tons of different potential touch points
Mm-hmm.
that help people stay accountable.
Yeah, that's brilliant. I love that. I kind of turned this into a bit of a personal consultation at some point. I appreciate the advice you've given, and also your passion for seeing more and more patients. I think that's really cool that you kind of are like excited that you saw more patients this year than last year, and you're having a bigger impact on society, because there's enormous amount of value in what you do at your clinic, and having seen you over the last few years has added a lot of value to my own life as well. There was a time, and maybe I should have introduced this, is that you and I were running along the beach trying to stay fit together.
I wish we were still doing it. We need some of that.
We need some more of that, David. So I really appreciate you being with me here. It's been an awesome conversation.
Oh, thank you. Pleasure to be here.